Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with the weekly podcast of the Common Sense MD. I'm going to talk a little bit about myself and my experiences today because I turned 70 years old a few weeks ago, and I've been a medical doctor for 40 years, so if I can't impart some wisdom to you now about aging, then probably not going to be able to. Plus, I studied longevity, and I've been around medicine my whole life. My dad was a doctor. He was a surgeon, although he knew something about everything medical-wise. We had many good discussions. He taught me so much. He was just an amazing doctor. I think the doctors back then were more amazing than the doctors today, really, because they had to know more about laying hands on, diagnosing. They didn't have all the technology we have, but they certainly were good diagnosticians. And so hopefully I have a lot of experience, and I love studying longevity, not only for my patients, but for myself. I've always told people I would never do something to a patient that I wouldn't be willing to do myself. So in any event, at 70 and beyond, the rules change for you. If you're really honest with yourself, you can't do some of the things you used to do. For example, I need to wear these glasses at times, especially when reading. I never wore glasses before, just a few short years ago. When I can't hear any better than I do now, at some point I'll get a hearing aid because I know it prevents dementia. So you have to almost biohack your way into better health. You certainly have to do things differently and smarter. There's just things that I do way differently. For example, I don't play tennis, I play pickleball. I don't do distance running. I sprint when I can. I think you need to be able to sprint. It keeps the backside of your body and your legs strong because you lose your butt muscles first before you lose the other ones. And they're very important with balance and things. As you get older, you don't want to fall. That's like disaster. So you have to work on your balance a lot. So be honest with yourself. You can't do things quite as well as you used to athletically, but other things maybe you can do even better, like decision-making, relationships, helping other people out. When I say the rules change, I mean you have to pay closer attention to what you eat, supplements that you take, which I'm a huge believer in, how you exercise, like I've been talking about, how you sleep, how you manage your hormones, because you lose them, you need to replace them. So one of the main things we do at Performance Medicine is evaluate and replace your hormones very safely. If you don't look into that, you're shortchanging yourself for sure. Most of us have some kind of impairment after age 70. There's no doubt about it. Usually much sooner, to be honest with you. But 85% of people over the age of 65 live with a chronic condition. 85% of us 70 or older, actually 65 and older, live with a chronic condition and are on medications for it. So I want to break this down real easily. There are three types of impairments mainly as you age that you have to think about. The first one I want to term energy impairment because life is energy, and when you run out of it, you die. Energy decline is usually a metabolic disease. Is aging a disease or not? That's a big controversy. So look that up. It's very controversial, but there's no doubt that life is energy, and when you're out of it, you die. And it declines as you age. But it's usually, I think of energy decline as a metabolic disease. It's a metabolic decline. In fact, all diseases really are metabolic in nature, whether it's heart disease, kidney disease, liver disease, lung disease, vascular diseases, diabetes. Even cancer is a metabolic disease, in my opinion. It's not mostly a genetic disease. It's mostly it's mostly metabolic. I'm convinced of that. So your metabolism is the most important thing to take care of as you age. Think nutrition and supplements here. Remember, obesity is a disease. So if you have a belly, you have a disease called insulin resistance. Listen to my podcast about this. So energy impairment's the number one thing that I see. Number two is orthopedic impairments. All my orthopedic doctor friends are the busiest doctors out there. Why? Because of older people breaking down. My own impairment here is a bad back. I never thought I would have a bad back, but I in fact do have a bad back, what I call a bad back. I have to really work on it. A lot of physical therapy. It's common at my age, low back pain. In fact, it's so common that if you don't have it, there's something unusual about you. Your spine is very important. Take care of it. Look at how people walk as they age. I was in Florida recently on a little winter break like I usually do, and I love to observe people. And down there you see more older people, of course. I like to watch them walk, and I like to watch their posture. You know, most of them have a gait abnormality, and they also have a forward flexion of their neck and a kyphosis of the thoracic spine. So I love to watch it and think, how could I improve that? I'm working on it continually myself. Every day as I walk, my posture, I think about it all the time. Because in the past, my posture has not been very good. And as you get older, your spine degenerates. You lose height and you lose posture. And you lose muscle. So it's kind of when I watch a lot of these people, it's very sad to watch most of them get around. You know, if they don't have a cane, just watching them walk is very interesting. They have very little muscle tone. We lose muscle as we age. It's another reason you need hormones. So our women need testosterone just like men do, as well as estrogen, progesterone in women. So this means that you need to get an assessment, preferably from a physical therapist, to see where you are and a plan to increase muscle, straighten your posture, getting you moving better, easier, getting up from a chair, being able to get up from the floor without using your arms, as I've demonstrated before on some of my podcasts. Most older folks are very stiff. And remember, the ultimate stiffness is death. If you don't address this, you're going to be pitiful and miserable as you age. Think about chronic pain. Hurts. So move. Get an assessment. Start thinking about this now. And if you have problems, that you probably do, get them looked at and get them fixed. You may not ever be able to dunk a basketball again. You won't, but you can move better. Your posture can be better. Think about that. The third and last impairment is cognitive impairment. Did you know that 2 out of 3 Americans have some level of cognitive impairment at age 70? It starts with memory loss. I watched my own mom's slow decline with Alzheimer's disease until it killed her. You know, I talked to my dad many times as he was the primary caretaker. And one thing I'll never forget is, as I was leaving the house one night, how he told me that it wasn't as easy as it looks. And it's not. It's not easy getting older. You got to start thinking about this. You don't want to get cognitive decline. That's the thing people fear the most, really, is Alzheimer's, I think. I know. Saw it in my own mom. And I think it's mostly preventable. That's the thing. Some people call Alzheimer's type 3 diabetes. So again, this is a metabolic disease. Alzheimer's is metabolic. Although I always check an ApoE gene on people when they come in for their Clevelands, because I want to know where their genetic risk lies well, along with their methylation genes, which are very important. So it's a metabolic disease. And another disease I think is metabolic is cancer. Heart disease, cancer, dementia. Those are the big three that you have to think about. Besides treating your metabolic disease and moving, and note that exercise has been shown to be one of the most effective Alzheimer's prevention tools is exercise. And think about your relationships. People that are lonely have cognitive decline. Think about the relationships and how important they are. And think about learning new skills. I don't want to retire. I don't like the idea of retirement personally. I don't think I'll retire until I just plain have to, because I love what I do. It keeps me sharp. But I do other things as well. I learn new games. I play guitar, as you can see. I love music, and I'm not a good guitarist, but I love practicing and trying. I think it helps me cognitively. I really do. But think about your relationships. And think about helping other people. You'll help yourself. We're all going to age and decline and eventually die. But how fast it occurs depends on how you live. Stay tuned, because as a 70-year-old medical doctor, longevity studier, there are many biohacks to keep you healthy, and I'm going to keep you abreast of these as I continue to age and I continue to practice medicine, which I love. So hopefully this is going to help you as you age. Think about it, and I'll see you next week.